Welcome to Wax Off. My name is Robina Rayasat and I'm a hearing aid audiologist. I'll be talking through our earwax removal videos, so let's see some wax. This patient, let's call him Samuel Tali. He's always a very happy, smiley patient of mine, and that's why his name is Samuel. An absolute pleasure to see, always super thankful once his ears are cleared. Now his right ear, which you're seeing on screen just there, always gets really itchy when it blocks up, and if he doesn't get it removed, it can become a full-blown infection for him. You can tell from the consistency of the wax that there is an infection which is beginning to brew there, so he did have this removed at the right time. Now this earwax removal is a little messy at the beginning because of the oiling, but the views get really quite excellent afterwards. So here I'm simply removing the oil on the end of the endoscope. Now we're going back in and you can see the redness on the side of the canal wall. That's because of the itching sensation, because he's been rubbing his ear from the outside, because it's been quite uncomfortable for him. So the consistency of the wax is really quite runny, not just because of the oiling, but because of the infection also. You can see everything is being sucked in really quite quickly, which shows just how runny it is. Now as we begin to remove the blockage and work on the periphery, you can see bits of keratin are beginning to be lifted up, and I'm just simply going around and seeing which parts are ready to come off and which parts aren't. There we can see the redness again of the entrance of the ear canal. And there's quite a big piece of keratin stuck to the canal wall there. And I'm going to see if I can possibly remove that. Now as we're suctioning that area, you can see suddenly quite a thick layer of skin appears at the top. It lifts up. It does want to go back down, but I think the majority of that will come off. Again, in the background you can see just how red the eardrum is because of the itching he's been getting inside his ears. And when we compare the other side, you'll see just how red this is, but that is coming off really nicely. There we go, it's been suctioned right into the tube. Lovely. Now Samuel does have quite a lot of hairs in his ear canal, but once we get past this, the views are good. So we're going around again to make sure that we can get those little layers of skin removed as much as we possibly can. Now at the top there, we suddenly find that as the suction probe touches that area, we're getting more skin coming off. Just trying on the posterior part of the canal wall. That's quite a lot that just came off there. Great. And that is a huge sheet of skin pull. Very nice. That's going to clear up a lot of the infection and reduce the risk of it coming back because we're removing all the debris. Fabulous. It's going right up close to the eardrum itself. It's quite deep down. This layer of skin extends, and it's quite thick also, which is unusual for it to get this thick deep down because it's the newest skin very close to the eardrum. So you would expect it to be the thinnest because it's the least debris that the skin has produced in that part of the ear canal. You can see it's literally right, very close to the eardrum, right almost against it. So I've tried to remove that area which is very close to the eardrum, but it's not coming off. So as I've come out of the ear canal, I'm going to remove some of the peripheral wax at the entrance of the ear canal, which is coming away in bits. Now I've oiled again here, and what you'll see is that little piece of keratin that wasn't coming off in front of the eardrum has also been lubricated with the oil, and suddenly it's disappeared. Although it's not disappeared, it is still there. It's just now been so well lubricated that it looks transparent, but we're going to leave that because it's so close to the eardrum. Now I'm going to the entrance of the ear canal and removing as much of the peripheral skin that's ready to come off, just gently putting the probe tip into those areas. There's a lot of little good skin pulls there, and you can see the eardrum quite well here. Again, lots of dilated red capillaries. And we're just making sure we're trying to remove all of those excess debris at the entrance so it doesn't go back into the ear canal and cause another infection. His ear on this side after the procedure dried up and it didn't need any medical attention. You can see the importance of removing all of the debris, or as much as you possibly can, to stop that infection in its tracks. So a little bit of a wipe on the end there, and here is the final shot of the eardrum and the ear canal with the probe in situ. Again, very, very red and just needs time to heal. Very good skin pull there. It's extended right to the bottom of the ear canal. Very nice. And Samuel Tali felt so much better after this procedure. The itching went away immediately, so he was very, very pleased. Now here's the left side. So you can see there's not actually much wax here, and there's a bit of wax just on the eardrum itself or just in front of it, but most of the wax is quite dry. It's around the periphery, and we're going to start off on the peripheral wax. It's coming away quite nicely, and in this shot you can really tell the difference between the skin colour and texture of the right ear where there was an infection brewing, and this ear which doesn't have any infection signs in it. And we're starting off with that area which doesn't really want to come away. It's a bit of keratin. We're Going to use a bigger probe to see if that helps with it. So this wax that you're seeing here is the normal type of wax that he produces. The softer wax that was on the other side was definitely caused more by the infection and the oiling, but this dry type of wax is his normal wax that he produces. So we're now suctioning the top of the screen area, and because there was a little bit that went into the suction probe, the area that we were trying to get at the bottom also came out as well, because that essentially increases the suction within the little tip. We're going to try to remove a little bit more of that peripheral wax. Not all of it is likely to come away though, because some is still stuck to the canal wall. But as always, I will try to remove as much as I can safely and gently for Samuel. Carrying on that area. The peripheral wax is peeling away quite nicely there. Very good. And again, it extends quite deep down into the ear canal and is actually quite thick as well in comparison to most ears. So we've just wiped the end of the endoscope there, and now I'm going to try to get that bit right in front of the eardrum. Very gently. There you go. It came away nicely. So that actually would have fallen back into the ear canal maybe whilst Samuel was sleeping or laying down on that side, because the ear wax would usually fall out the other way, out of the ear canal rather than in. For me, this ear really shows visually the difference between the ear canal that is surrounded by the bony portion, which is the inner 2/3, which is very smooth, and the outer 1/3 portion, which has the cartilage and the hairs and the glands. So there's two types of glands there. There's the sebaceous glands and the apocrine glands as well. And you can almost see the line where there is a difference between the bony portion and the cartilaginous part, which I think is very interesting. So we still have some wax on the anterior canal wall, just to the left view, just there. Now this is a tricky one because of the angle, due to the way you have to hold the endoscope. It is a bit tricky, this part, and although it isn't causing a blockage, I do want to remove it if I can. You can see that the hairs are obscuring the views and making it a bit difficult to see on the camera what I'm actually doing, but there are small bits of keratin that are coming away at the end of the suction probe. It's just being obscured by the hairs. It's also suctioning up the hairs as well. You can see a couple of times the hairs, a bunch of them go up into the suction probe. So I'm going to try one last time to see if I can very gently remove it without causing any discomfort to Samuel. Although it's difficult again to see there is a little bit coming off, but it's a minute amount and really probably is not ready to come off. Having said that, even though this wasn't a full blockage, removing that dry piece of skin right in front of the eardrum will allow it to flex better and for the whole auditory system to work better, because that piece of keratin would have stopped the eardrum from moving as it should do. So here's the final shot of the left eardrum. Samuel Tali does have a little red speck on his eardrum, which is on what's known as the handle of the malleus, which is the bone attached to the other side of the eardrum. It seems like it's a very tiny collection of capillaries on it, which is made almost like a beauty spot pattern on his eardrum, but this was there the last time I saw him, and because of this, if his eardrums are ever in an identification lineup, I'm sure I'll be able to recognize his left eardrum, because it's a bit of an unusual pattern to have. So thank you so much for watching. I really do appreciate everyone's comments. I appreciate everybody coming back week after week. So please do keep watching, subscribe, comment, and I will see you in the next one.